Welcome to Western Perspective. I'm Sarah Smith. Australia's vaccination bungle is dragging on as the East Coast remains in lockdown with no end in sight. Compared to 38 developed countries around the world, Australia came last when it comes to the percentage of fully vaccinated population. It's well known that many consider the federal government's vaccine rollout slow. So the question is, how have we failed where other countries have succeeded? Our reporter Kit Sanders joins us now for a discussion on how this will affect young Australians. Kit Sanders, thanks for your time. What are the major concerns regarding the speed of the vaccine rollout?
Well, for one, we've had limited access to the Pfizer vaccine, which is preferred by a lot of doctors and Australians. And there are risks associated with the AstraZeneca vaccine, though these have been blown out of proportion. There are several vaccines approved by the Therapeutic Goods Administration, and each have their pros and cons. And we're relying too much on one vaccine. For example, the Johnson & Johnson vaccine has been approved, and while it carries some risks, it has benefits like only requiring one dose. This is great for accessing regional communities or those that have to travel unexpectedly and don't have 3 to 12 weeks to wait to be fully vaccinated. Additionally, the messaging of the vaccine rollout has been a mess. The Prime Minister has been telling Australians that the vaccination rollout is not a race, but it is. It's not against other countries, but against COVID itself and all the lockdowns we've been facing. As of Friday, we had 1,700 Australians with COVID, and 155 of those were in hospital. Finally, the supply of vaccinations across Australia has been inconsistent. As an example, more than 200 GPs have stopped providing AstraZeneca vaccines because they didn't know how many vaccinations they were going to receive week to week, and then they were having to cancel these appointments while other GPs had excess.
Based on your current observations, what can be improved so that more Australians could be vaccinated?
First of all, consistency of supply. Doctors need to know how many vaccines they will receive and what changes to a rollout will be in advance so that they can plan accordingly. Additionally, I believe we would see a huge uptake in vaccinations if people were able to book at pharmacies or have vaccinations at work, much like the flu jab drives. Here in WA, we also struggle with people who can't access the vaccine. We need to be vaccinating the close household contacts of those frontline and high-risk workers. Otherwise, it's just a matter of time before we end up with another case escaping hotel quarantine and spreading to frontline workers, families and community. I believe that we also need to fix vaccination in rural and remote communities where viruses can hide easily undetected. Johnson & Johnson would be good again for this, as farmers and people in rural areas who come to the city for healthcare don't have to return for a second dose and will likely increase uptake simply because of convenience.
The TGA has approved the Pfizer vaccine for use on children aged 12 to 18. Where do we go from here following this announcement?
I believe this is a great step to take somewhere down the line. Schools can be huge locations for spread, but as Australians, we value education so highly we don't want to be closing down schools. We need to consider the balance between vaccinating our adult population, which is more at risk, and ensuring our schools are safe. We need adult herd immunity, but also need to protect our communities. I think once we have a better idea of these figures, then we'll be able to put into plan how to implement that in our rollout.
The Prime Minister has now apologised over the rollout bungle. Do you believe that this acknowledgement will be enough to fix the problem?
No, words don't make changes. Saying sorry is just a ceremonial gesture. Only time will tell if he actually makes the changes to fix the issues that have so far left Australia unprotected. We've seen a marked improvement recently, especially since Pfizer has agreed to supply Australia with 1 million doses per week, though this is not the end of our struggle just yet.
Kit Sanders, thanks for your time.
No worries.
And now here's this week's COVID-19 commentary with AMA-WA spokesperson Dr. Andrew Miller.
Hi, what we're seeing in Sydney at the moment with the case numbers there is very worrying. Again, another rise today in not only the number of total cases, but also the number who've been out in the community whilst infectious. And so what we're seeing is the maths of a pandemic in operation in Australia, similar to the way we saw it in Victoria before, but with a more infectious variant, unfortunately, in the Delta strain at the moment. It's becoming infectious within 24 to 48 hours, it seems, of contact, and that's terrible because these people are still often asymptomatic at the stage that they're passing it on to multiple other people. The reason why we then lose track of it at relatively low case numbers is because the object of contact tracing is to get a hold of all of those people and get them into isolation, all the possible contacts into isolation before they become infectious in turn. And the contact tracers are just not keeping up with that for two reasons. One, the disease is moving so quickly, and secondly, because you can't increase your number of contact tracers as fast as the disease is spreading. When you get to these sort of numbers where people have 1,000 or so contacts, you just cannot physically have enough people on board to go through the finding all of those close contacts in time to prevent them passing it on. So what do? Well, you manage the outbreak in reverse by essentially isolating everybody, whether they're positive or negative, and that's what a lockdown does. So you get rid of all of your big gatherings where you can get a super spreading event. You get rid of as much human interaction as you can. And so what we've seen in New South Wales is what they call the proportionate response to that, but unfortunately that's a bit like playing chicken with the Delta variant. Everywhere around the world that's tried to do that has been humbled and has had to go to extreme lockdown places like Guangdong and so on. So we really do need to take this incredibly seriously. The approach of the West Australian government is superior to that of New South Wales in that sense, and we need to continue with that. But we can't take our eyes off the things we could still improve in Western Australia, and there's lots to improve. Our hotel quarantine system is still a shambles and does not have adequate levels of respiratory type PPE. We have very few cases of Delta in Western Australia at the moment. There's no reason why they should be in hotels or anywhere else other than in isolation ward or in separate air-gapped quarantine facilities by this stage of a pandemic. The government really needs to get on and take care of that. The vaccination, obviously the other hot topic at the moment, and in New South Wales now they're saying, well, look, we might be losing control of this, just go for AstraZeneca, whatever age you are as an adult, despite the rare risk of 1 in a million people dying from complications of it. The risk in New South Wales at the moment of dying of COVID is greater than that, and that's because it's spreading through the community. So we're still in the fortunate situation in Western Australia where we can say AstraZeneca on balance is probably safer in those over the age of 60. But if people want to have it because they're concerned of seeing the way that this is spreading around the country, then by all means discuss that with your GP. And the Pfizer supplies will hopefully be coming online very soon, and I'd encourage everybody when you get an opportunity to get an appropriate vaccine to get out there and get it. Stay safe and continue to encourage anything that will keep this out of our community, because we can see that once it's in there, mice plagues and weed infestations, cane toads, everything else look very easy in comparison to trying to solve that particular problem. And I wish everyone in New South Wales and all of their loved ones all the best with dealing with what is a very difficult situation. The other thing to talk about a little bit is schools. There's calls for childhood vaccination, and we're very pleased to see that Pfizer has been recommended now in Australia as being safe and effective for those over the age of 12, as it's being used in many other countries, particularly the US, and we want to see that rolled out as quickly as possible, potentially through schools. Primary school age children, the next consideration, trials being done in Israel and other places. Hopefully we'll be able to protect all of our kids from this disease the same way we do the rest of the childhood immunisation schedule for things like polio and diphtheria and tetanus and all those horrible, horrible things that most of us have managed to grow up without them affecting our lives. So let's put COVID in that box as well, get kids vaccinated as soon as possible. Thank you.
And that was Dr. Andrew Miller. And that's Western Perspective for this week. We'll be back next time, but for now, it's back to you, Ivan and Brianna.
Thanks, Sarah. And here's Leo with what's coming up on 6 News tonight.
Thanks, guys. Tonight on 6 News, breaking news. New South Wales COVID case numbers continue to rise, with Greater Sydney set to continue their lockdown for potentially many more weeks, but plenty of people aren't happy with protests calling for the restrictions to end. Plus, the Morrison government faces more criticism over how it's handled the vaccine rollout, and this latest outbreak. Will speak live to Sue Fricky from Voices of Kooyong to get her thoughts. And the winner is Brisbane 2032. The Olympics will be heading down under. Our reporter is on the ground with the reaction from Australia's third Olympic city as the games kick off overseas. Plus, we'll explain the tough rules the IOC has for TV networks not given the Tokyo 2020 rights. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, and our website 6newsau.com. For now though guys, it's back to you.
Thanks, Leo, and that's our weekly news and current affairs. We have the latest on our website, wamnnews.com.au.
We hope you have enjoyed our company as much as we've enjoyed yours. From Brianna and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.